Hello. I'm here to do a video on, the healthcare policy for RISE Early Education Academy and Azbuka Kids Center. So this video will be all about the healthcare policies, how to prepare, how to respond, how to plan, etc. So let me read the table of contents. So first of all, we'll talk about some basic information. Then we'll talk about emergency contacts, medical emergency contacts. Then we'll talk about vaccination requirements for both children and staff, children's documentation for registration that we receive. We'll talk about illness, injury, and emergencies. We'll talk about managing and reporting infectious diseases. We're going to talk about planning for mildly ill children. First aid, transportation to the hospital if needed, when needed, emergencies while on a field trip, plan for injury prevention, assessing injuries to children in care, individual health care plans, medication administration, omissions and errors, possible adverse reactions, food safety, allergy prevention, plan for infection control, procedures for using and maintaining first aid equipment, mandatory reporting, and then a staff signature page saying that we have reviewed this with you and that you understand it. I will have an assessment for you. The assessment will include statements on the healthcare policy and as you understand it. So you can go like 1 to 5, whether or not you understand it or don't understand it and need more learning on it. So I'd like you to do this assessment prior to doing this video. And then, so be sure to do that. If you don't have it, just ask. I will put it in your timesheet folder in the file cabinet. And then you can fill that out, then do the video, and then return to that assessment and do it again. And then you can compare and see if there are things that you didn't learn and you didn't understand. If I missed something, please let me know and then we'll fix that. Okay, thank you. So I'm going to talk a little bit about basic information. So we have a binder that's located in the hall, right in the entrance. It's a white binder. And it has all this information in it. So if you need to refer this, you remember back, this is the information that we learned. Oh, I just need a quick reminder. This is where you go. So basic information, our facility name is Azbuka Kids Center, or also known as, or DBA, doing business as RISE Early Education Academy. Our address is 5 Andover Road, Unit 2, which is the lower level, in Billerica, 01821. The entrance, obviously, is in the back of the building, not the front. So the main contact for this unit is, or for our facility, is Natalia Ivanova. So Unit 1 is the preschool classroom, and Unit 2 is the school-age room in the office. So the emergency kit locations with health first aid supplies. One is inside by the entrance door to Unit 1. So that's the preschool classroom. So you go right in. This is the backpack up on the right. It's hanging so kids can't get it. And also there is, if you go to the left, the backpack's gone or it's not available, you don't want to reach that high or go into the backpack. The emergency kit is on the wall in a little box. It's a brown bag. And there's also a thermometer there that's not in the brown bag. So it's either in the box or on top of the brown bag. This is your emergency kit. And in the preschool room, in Unit 2, it is also, or Unit 1, Unit 2. There's also in Unit 2, so if you go into the classroom, on the right, there's a bookcase with games and such. You look all the way on the top, you'll see a backpack, and that's the emergency backpack. And then you'll also see a big white metal box. That's the first aid kit. These 4 things are searched by me and reviewed by me at the end of each month, and to check to see if we have all the supplies in it. And also, let's replenish after we've used them. So just let me know if you used a nice pack. Band-Aids, we don't have to, let me know. But just the things that were added in there for like 1 or 2 of them, we just want to make sure that we've replenished after they're used. The AED. The AED is located in the kitchen. So open the door, look to the right, you'll see this big black box. That's the AED, and we'll go through that too. This is learned at a CPR first aid course. So when you take your first aid and CPR course, and be sure it's pediatric and includes AED teaching. So then if we're asked in an emergency how many children we have for our license, we have 20 children. This is for EEC license, and the ages of these children are 2-9 or 33 months up through age 8. So the emergency contacts are also in this book. The police department, of course, call 911 if there is a dire emergency, and that would include, broken arms, broken legs, something that we cannot fix ourselves. We dial 911. It's a real emergency, and be sure to do this for staff as well as for children. If it's in your mind, just do it. Non-emergency, the number is 978-671-0900. Emergency medical services, which is the EMS, an ambulance. We're going to call the 1212 number. It's 978-667-1212. The fire department, again, is emergency 911. And again, these numbers are located on each and every wall. There's a wall in the hall, there's a wall in the classroom, and there's a wall in both classrooms with these numbers on it. Or you can get it on this book, or you can get it in the emergency preparedness information. The non-emergency business line for fire department or emergency police department is 978-671-0940. Fire inspection is 978-671-0940. We're up for one on June 12th. Every June 12th of the year, and we have a fire inspection to inspect all our prevention areas that pertain to fire prevention. The Poison Control Center, we should have this in our phone actually. It's 1-800-222-1212. Healthcare consultant, Ekaterina Peterson. Her number is 781-856-5812, and we also have her email address. This is her certificate that she's a nurse practitioner, and she works for us as our certified nurse practitioner authorization. So she's our go-to person for nursing or healthcare consulting. We had her in one time to do a training on an EpiPen, and that was very informative. Because we do have children with an EpiPen, be sure you get training. If you don't have training, you can't use it. But then again, if it's an emergency, use it. Circle Health Urgent Care is a local urgent care. It's on 199 Boston Road, North Billerica. The phone number is 978-323-2850. The closest hospital is Leahy Hospital and Medical Center. It's at 41 Mall Road. EMS would probably bring our children and adults there. 781-744-5100 is the number. And again, it's on our emergency list in the healthcare binder. The Billerica Health Department, the director is Crystal Bennett. 978-671-0931 is her phone number. and she's at 365 Boston Road in Billerica. There's a child at risk hotline, and that number is 1-800-792-5200. That's a number that you call if we find a child, and we suspect a child is at risk. And we'll go through that a little bit more. And there may be a separate training on the mandated reporter, because it's a good idea if you have not filled out a form for the state and you don't know what the form looks like, and and you're suspecting that there's a child being abused, because we're mandatory reporters, we should know how to fill out that form and not hesitate. So it's not scary. So there'll probably be another training on that one. So program director is myself, Deborah Rosado. My work phone number is 978-437-3045. And my home phone is 879-781-6310. The landlord. We do have a landlord. She lives right next door. Her name is Stella Belarus. And typically, if you have a problem and you need a landlord, let me or Natasha know, and we will reach out to her. So at Rise Early Education Academy, we prioritize the health and safety of children above all else. Our goal is to create an environment that is safe and healthy for children, parents, and staff. So our healthcare consultant, again, is Ekaterina Peterson. In our environment, these responsibilities may be shared among all staff members. Our goal is to raise awareness of health and safety issues among children, parents, and staff, and to minimize hazards and risks, ensuring that children can flourish in a safe and healthy setting. Health and safety issues are explained to the parents of new children to ensure they understand their role in the daily operations of the setting. It's in the parent handbook as well, so they have access to it. Health and safety training is incorporated into the annual training plans for staff, and these topics are discussed regularly at staff meetings. So by all means, bring up something. If you see anything happening, or if you see a health and safety risk, please bring it up and we will address it. We enforce a no smoking policy. Again, that means out in the parking lot as well. We have had issues and we have resolved them, so we will resolve them. Children are educated about health and safety issues through discussions, planned activities, and daily routines. And you'll see some of those within our daily routines in the classroom, our schedules, and within this binder. Vaccination requirements. We strongly recommend that your child's immunizations are kept up to date. So your child's, the child's immunizations are kept up to date. The Department of Early Education Care has separate requirements for immunizations for children and for educators. These requirements aim to maintain high vaccination coverage rates and reduce the risk of vaccine-preventable diseases, which are called VPDs. So here are some key points about vaccination requirements for children. Required vaccinations. Children typically need vaccinations against diseases such as chickenpox, diphtheria, HIV, which is Haemophilus influenza type B, hepatitis A and B, measles, mumps, pertussis, whooping cough, polio, pneumoconiosis, rotavirus, rubella, and tetanus. Exemptions. Now, if there's a child that a parent does not want them to receive, there can be a medical exemption. If a child cannot receive vaccinations due to a medical condition, a statement from the primary health care provider is required to document the exemption. We also have a form on file that a parent signs and that we sign so that we all understand and know that a child is not vaccinated. And a child that's not vaccinated is more at risk of getting these diseases. So they will mostly be asked to not attend school if there's something going on that is preventable. Foster care and homelessness Children experiencing homelessness or in foster care may not need evidence of vaccines before enrollment. However, an immunization plan should be initiated upon enrollment. And religious beliefs. Massachusetts allows exemptions based on sincere religious beliefs. In such cases, evidence of immunity to communicable diseases is not required. Outbreaks and consultation. The program maintains a list of the children who have documented exemptions from immunizations. So during an outbreak of a vaccine-preventable disease, non-immunized children may be excluded from school until they receive the appropriate immunizations. Health departments are consulted to make these decisions. So the Massachusetts Immunization Program provides free childhood vaccines. So if there's an issue there, the toll-free number is 1-888-658-2850. Feel free to give this number out to any and all parents that may need some assistance. Children's documentation for registration. Parents need to provide the following documentation upon registration and enrollment for classes or preschool. Documentation of lead screening of the child. Childhood lead screening must be done on all children. It's not considered an immunization. It's usually done between the ages of 1 and 3, and typically it's written on their health report. So the lead screening and then immunization records are always kept on file in our files, so we know the immunizations of the children, and physical exam records from the last pediatrician visit within a year is kept on file as well. Illness, injury, and emergency. Our facility is responsible for ensuring that staff and children adhere to the health policies and guidelines set forth. If a child becomes ill or injured while at the facility, parents, guardians will be contacted, or emergency contacts will be contacted. If parents cannot be reached, emergency contact list will be used. So be sure that the emergency contact list is up to date, and this is for the parents. If you feel that you know something about the parents and the family and you see the list and they don't have that contact on that, please discuss it with the parents. Sometimes they don't come to me as director or Natalia to update their list. So it's a good idea to just confirm them. In case of a medical emergency that requires a trip to the healthcare facility by ambulance, one employee will accompany the child if the parent is not available and provided we have enough employees. I would really not like to send a child off alone, but if it's an emergency, it needs to be done. And for the well-being of all children, we ask that we keep children at home if they exhibit any of the following symptoms. So we as staff can keep an eye out. We can remind the parents of these. Pain. Any complaint of an unexplained or undiagnosed pain or general discomfort. Fever, a temperature above normal, 98.6 Fahrenheit or 37 degrees Celsius. Excessive coughing, sinus or nasal infection, usually a green runny drip. Contagious diseases such as chickenpox, measles, etc. Skin disorders, including ringworm, scabies, pink eye, lice. Vomiting. If there's vomiting within the previous 24 hours, the child cannot attend school. Excessive diarrhea. After the first one, I usually warn the parent. If there's another one, they need to be picked up. Respiratory difficulties. They're having trouble breathing. We contact the parents. If it's the one with the EpiPen, we do what we need to do. Any symptoms of COVID-19, and we'll go through those symptoms too. COVID-19 is still around. It's being treated like a flu. And I'm not sure if I'd updated this or not. I may come back with how we treat COVID-19. I think we're treating COVID-19 the same as any other flu. We're not doing masking unless you prefer to. Um, so symptoms of respiratory illnesses, including the flu and the common cold, are fever, chills, cough and worsening or chronic cough, shortness of breath, sore throat, runny nose, loss of sense of smell or taste, headache, fatigue, diarrhea, loss of appetite, nausea and vomiting, and muscle aches. In accordance with the Mass Department of Public Health and Center for Disease Control and Prevention recommendations, Rise Early Education encouraged students diagnosed with the respiratory illness, including COVID-19, the flu, etc., to stay home for a 72-hour period to prevent further spread. How many days is 72 hours? 3 days. If a child tests positive for COVID-19, the following criteria must be met before they can return to the school. I would say this is for all respiratory. Symptom improved. The child must have experience in improvement in symptoms for at least 24 hours. All the symptoms I just listed for at least 24 hours. If they were sick last night and they're not sick this morning, they need to hang out at home. Fever-free period. The child must be fever-free for at least 24 hours, and that's fever-free without the use of any fever-reducing medications. Post-return prevention strategies. Upon returning to school for the next 5 days, the child is strongly suggested to follow the Mass DPA recommended prevention strategies. Well, this was back in when there was COVID. Wear a well-fitted mask, except when actively eating, drinking, or while outside, and maintain a distance. So we're not doing that right now unless you feel comfortable that you need to do this for your child. Exposure, and again, this is after all the symptoms, 72 hours after the symptoms. So exposure to COVID-19, if your child has been exposed to a positive COVID-19 person, they do not have to quarantine as long as they are symptom-free. They have no symptoms, they have been subjected or exposed to positive COVID-19, they don't have to remain home. They can come to school. In the event that your child is sick, or that our child is in care is sick, if the staff determines that the child should not remain at the center due to illness, the parent or guardian or on the emergency list will be expected to be notified and are expected to arrange for them to be picked up as soon as possible. Within 1 hour is a good time frame. So if we're texting or whatever, we usually say to the parents they need to be picked up within an hour. Prompt pickup is crucial to minimize exposure to other students as well as staff. So, but we will keep the child away. We will, there'll be a quiet area for the child to rest with extra care and supervision while waiting for the parent or guardian or emergency pickup to arrive. This could be on a cot. A cot would be suggested, maybe with the administrator in one room while the preschool children are in the other, or over in a corner where there are no children, so the child can stay quiet. Give them some fidget toys or some quiet things while the parent is on their way or the guardian's on their way. So before returning to the facility, we may ask the parents to confirm that their child is free from symptoms for at least 24 hours. This precaution, again, helps control the spread of contagious diseases and ensures the well-being of everyone in the facility. We don't want sickness. We clean and disinfect, and we really take our time to keep the facility clean, carpets, walls, door handles, etc. And so we want to make sure the kids are clean too. And the adults. If a child is sent home due to symptoms that could be related to COVID-19 or the flu, it is required that the child be tested for COVID-19 before returning to school. Again, that could be questionable. It talks about a home test. So if the child is going to be absent due to illness, the parent is to contact us prior to the expectation of the child. So Natasha and I, both Natalia and I, will get a text from the parents. And if we don't get a text from the parents, please let us know that the child's not there. And we will, in turn, text the parents and make sure that the child is either coming or not coming. And if it's due to an illness, we'll be sure to record it and let the parent know what the policies are for return. Let's see. We adhere to the health and hygiene guidelines provided by EEC. This includes regular hand washing before and after meals, after using the washroom, diaper changes, cleaning bodily fluids, blowing noses, handling garbage, and touching pets. We also routinely clean and sanitize washrooms, floors, tables, chairs, kitchenware, toys, children's beddings, and all other equipment to prevent the spread of infectious diseases in our facility. I just want to say one thing about blowing noses. Blowing noses, sometimes we help a child blow their nose, and it doesn't come through the tissue, but we may feel some wetness through the tissue. Instead of racing to the bathroom, I use that liquid hand soap that's available in the preschool classroom. It's just as easy. I mean, it's, otherwise we're running back and forth, back and forth. Same with the child. Just wash the child's hands with that liquid soap. Yep. Let's see. Head lice policy. Any child with visible signs of head lice, including live lice or live eggs or nits, will be excluded from school until the condition is fully treated. The following steps must be taken for the child to return. The child must be visibly clear of any lice and or nits. The child must have received appropriate treatment for the lice infestation. The center will conduct a thorough check of the child's hair before allowing them to return, and daily head checks will continue until the reinfestation period is over to reinforce our no nit policy. So that's it for this session, and I will return in another session. Yeah, take care.